something that come up quite frequently in listening sessions is what sort of advice do you give to people who just can't afford mental health services and who are really in need of them?
I think it depends where you are. Because as crappy as the American healthcare system is, there are ways to make it work.
Right.
And there are free mental health services available for people who are low income.
Right.
If you're on, so in California, if you're on Medi-Cal, which is our version of Medicare, you have access to free mental health care services through your insurance, and it depends on your income. If you're on Medi-Cal and you're in if you have full scope Medi-Cal, basically, if you have full coverage and full insurance, then yes. If your income is low enough to the point where you would have free medical services and everything, then yeah, it's going to be free. But Medi-Cal also is for low income people who also have copays, who have, we call it share of cost.
Right.
And they are relatively low and are pretty flexible for a lot of people. I think the biggest issue is more so that people don't know where to get the resources as opposed to there necessarily being any.
Right.
And I think if you take the time to look, at least in the States, there are people who are willing to do sliding scale. If you find the right therapists, you should be able to get relatively low cost if you're lucky enough. There are community centers out there that provide very affordable therapy. They kind of run off of the generosity of those who can pay more. So they're out there. You just need to be able to find them. I think it's our goal to try to find those and connect people with those, but even for us, it's hard to. And
because it doesn't seem to be much of a unified kind of database for these sorts of services.
No, and even if there are Asian-specific mental health resources, a lot of them are still most of the people that we've been in contact with have been private practice or with the directories that we have looked at, they're still beyond what most people would consider affordable, though a lot of them do take insurance. But the question being, if you don't have insurance and you don't have the availability, there are organizations out there, and we're trying to figure out how we can help people to get connected with those and how we can partner with some of those agencies to really set up a network of here are the people that you should go to for low-cost services. And for those of you who are in the States and have access to schools nearby that offer counseling programs and degrees, you can always see a therapist in training for very, very, very low costs. Where I went to school, I believe it was maybe $15 a session.
That's pretty good.
Yeah, and I think that's pretty reasonable. I don't remember if it was 15 or 20. It was definitely below 30. And so if you really take the time to look around to see if there are any schools that offer therapy programs, you would likely find that they offer counseling services. Though I have heard that they do fill up quickly. That's definitely an option for a lot of people. It is harder in some states to get culturally specific mental health services. Even in California, where we have a very large concentration of Asians, it can sometimes be difficult in some of the less Asian populated areas to receive mental health services that are culturally specific. So, but if we're talking about just being able to get therapy, I don't have a lot of experience with other states, but I would assume that the Medicare system, if you have a somewhat decent one, would be able to kind of cover and meet those needs. And I know that a lot of states are not as lucky as California to have, I guess, comparatively pretty decent benefits.
So, where would you suggest people start their search? If they had to put a Google search in or something, because I think most people are just unaware or just have no idea how to start looking.
I think it's hard because even for us, when we put in Google searches, we don't necessarily find what we're looking for.
Yeah.
You can always, I guess, if you type in like your city and then mental health services, you might be able to find more than you think. I know that in LA, we're very lucky, but I'm sure that if you type in your city plus mental health services, they should take you, most counties or most cities have a dedicated mental health department. So for LA County, we have the Department of Mental Health.
That's amazing. So you have different mental health like departments for each county.
Yeah.
That's incredible.
LA County is bigger than some states in terms of population.
Right.
So it would make sense for us to have our own bureaucracy, I guess.
Yeah.
There are definitely services that are for people. But I would start there. Another way would be to search for like mental health therapist jobs on Indeed in your city, and then you'll be able to find some of the places that are hiring therapists. And if they're hiring therapists, that means they offer services. So that's kind of like a backwards way to do it. Even for me personally, I found agencies that I've never heard of when looking for jobs on Indeed. So you never know. That might be, you might see a name and you're like, oh, that's like right around the corner for me, and I never even knew they were there.
Yeah.
I definitely think that there's still a lot of need that isn't met, but I think that there are also resources that are out there. People just don't know about them.
Yeah.